Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. On the program today, for those of you out there who are interested in ways that you can actually soothe or even eliminate arthritis, dementia, stress management, and other health problems, and you're finding yourself into the golden years, you'll be interested to find out about an alternative healing method that can actually help you do that. We can do things such as prevention as well as what they call palliative care. And our guest today actually brings this to the table and to the listeners out there when she was inspired through a diagnosis that her mother had with breast cancer. This experience actually created the seed and insight for what she calls the cohesive therapy approach, making the cornerstone of the profession and commitment of compassion and care a must. I'd like to welcome to the Beyond 50 radio program today our guest, Ms. Kapina Katerina. Kapina, thank you for being back on the program today.
Hi, Daniel. How are you doing? Yes, it's very nice to be back on the program.
I'm doing pretty well. I'm guessing a little massage could probably help alleviate some pain. But tell me about these modalities and how did all this start when you talk about what had happened with your mother?
Oh, yes. I know that the talk we're doing today kind of ties into the aging process. And what I went through with my mom was her recovering from her cancer. So what I learned while I was caring for her for cancers, I learned a lot by helping her at the Gerson Clinic, which actually my sister had introduced me to. And the Gerson Clinic incorporates juicing, different things with massage therapy, and I noticed a lot of clients had issues with fluid retention and things like that. And clients that were at the Gerson Clinic were not just people who had cancer, they also had things like arthritis or any kind of aging disability or any kind of, I don't like to call it a disease together, but a dis-ease, basically a discomfort of the body. I found actually while I was caring for my mom through this nutritional therapy and body work that I did on her, that not only was she healing, me and my sister were healing. Now, my mom did pass away, but her quality of life while she was going through her cancer passing was actually very good, comparable to what others might have gone through. And so, so it was very inspiring, and I still use those techniques up to today.
Now, let's go ahead and talk about, for instance, one thing that I think at times seems to be overlooked when it comes to getting treatment, let's say in Western medicine. And certainly we're not here today to beat up on one modality over the other, but to show how both can actually equally, as you've learned, support each other. But the power of touch seems to be one of those things that really isn't there too much. You know, you're there, you're at the doctor, or maybe you just recovered from surgery, and it's sort of like, here you are, and here's the healer, the nurse or the doctor. And there's a separation there and not really a connection in that much. But it seems that's changing. So how powerful is the power of touch?
So that is definitely, something I have found in my experience of being a massage therapist, which is what I'm credentialed to do. I started doing massage over a decade ago, originally in South Africa with Indian head massage at wellness fairs, etc., and didn't know that I actually had an ability to give people healing until I was at different health fairs and noticed a lot of people were lining up for my booth and felt very good after I worked on them. And when I worked on my mom, she also felt very good. And it was interesting because it was great. I learned new modalities and things like that throughout my massage career. But unless those modalities were being applied with a feeling of compassion and care, as if I was touching and caring for my mom or my sister or a loved one or now my son, the healing was not as profound regardless of what modality I used. And on the other side of it, I found that when I learned more modalities and incorporated more modalities with the healing touch, it really helped people to not just feel better on a physical level, but truly on a mind, body, and spirit level. So our topic today is related to aging. As people get older, they have dementia or these things that happen. In society, we tend to not, or like at hospitals, we don't incorporate any touch for multiple reasons because there's so much of a gray area with touch, so providers don't provide any kind of touch. Even if it's as simple as putting your hand on a client's shoulder, even if you're a nurse, and saying, everything's going to be okay, we're going to get through this, bedside manner, and things like that. I found that when I have my healing center, which I have right now, cohesive therapy, I've hired multiple different kinds of providers, and I found that some providers that were just really here just to work and get through the day and wanted to work, those clients, that wasn't a good fit for what we did. And I realized pretty quickly I needed to really have people here who are healers, who really can tune in with the client and what they need at that time and in that moment. And that all, it's all connected with the touch and seeing and feeling your client on multiple levels, not just in what you're trained in.
Right. So really getting in tune, so to speak.
Yeah, hearing them when they, and I'll use, for example, an elderly patient as example because that's what we're focusing on. The elderly patient comes in and, from the moment you meet them, just having eye contact with them, treating them like they were maybe your grandma, just being really friendly from the minute you meet them, the tone that you use, if they're hard of hearing, not being irritated by that, just working with them on that, finding different ways to talk to them, up to getting them on the table, noticing they're having a hard time getting on the table, help them, don't just let them struggle. And then while they're on the table, they might not be able to receive very deep massage work. And so that's where it's really helpful to have multiple modalities, like the dry skin brushing. So because you were asking, that not all modalities are alike. There's a lot of modalities out there, and not to judge any others. What we do is the foundation of what we do, which can be used, it's used in our treatments. I teach people to use it at home. So off of the table at any age is primarily dealing with what's the first barrier of the body? Skin. Skin's our biggest organ of our body. We somewhat ignore it. We know that we need to take care of our liver and our kidneys and all these kinds of things, but the skin is the first thing we need to take care of to be healthy. So at any age, with what anybody's going through, dry skin brushing, we use a dry skin brush. Simply just brush the skin like you would as if you were brushing your hair. That starts to, not just for an elderly patient, it gets them reintroduced to touch if they're not being touched a lot. So the brush is the first contact of touch. And then you take an essential oil, which is a different sensory experience. It's the sense of smell. So we start with the sense of touch, then the sense of smell. That's calming. And then by then the client is starting to develop trust in their practitioner. Then we start with the manual therapy, where you start with the massage with the hands. Different techniques like things that help with circulation, massaging the little fingertips. People have a lot of arthritis in their hands. Just getting circulation in the hands by simply rubbing them and teaching them. If you just start to rub your hands with this essential oil, the essential oil is really helpful because it's like a tool to do something. So if you simply rub your fingers with some oil, it will be very helpful. But if you use an essential oil, it has a medical value and quality to it. Like lemongrass, I found, is phenomenal for arthritis because it helps with inflammation, tendon pain. There's a lot of things that lemongrass does for the skin, for the tissues, for everything. So that's like, if anyone wants to know about it, the essential oil to use, lemongrass, and it's very spicy. It's very hot. So that's what breaks down things like scar tissue and things like that. So that's what, as far as like healing touch, using things like the dry brushes, the essential oils, and then doing the hands-on touch, where we're actually touching the body. And then that becomes a healthy, intimate touch for especially an elderly person who's not getting touched at all. They have no intimacy in their life. For some elderly people, their family members do really well with caring for them. Some don't, so they're kind of lonely. So that's why massage therapy or acupuncture or physical therapy, where you're not just touching the client, but you're caring as you touch.
It's interesting when you talk about the elderly in a position where they're not experiencing as much intimacy. You're starting to see that a lot with much younger generations with the disconnect that
Yes.
technology has caused. So you're seeing these same elements that generally are considered, let's not be too harsh, but old people diseases or old people conditions. But young people are getting these things now.
Yeah. Yeah. It's true. It's true. It's not really necessarily elderly disease because there are people who I meet at, different stages in their life. And you're right, you mentioned the digital media. I see like young kids, 13-year-olds, 10, 9-year-olds with spine conditions that are structural, which means structural musculoskeletal. So somebody can be born with scoliosis and be bending a certain way. Somebody can look like they have scoliosis, but it's because their fascia needs to be worked on and then their spine is straight. Now, a structural thing that they're born with, it's a whole different treatment plan because they're always going to have it, but it's more palliative. Somebody, lifestyle spine stuff, they're always folding forward, never doing backwards. They're always on their computers, always on their devices. They start to actually fold forward and grow forward, and then they can't stand up straight because they never stand up straight. So I think that, the younger generation is starting to have some of these things like early arthritis and stuff like that, repetitive stress injury from texting, typing, carpal tunnel, all those kinds of things. But the disconnect with the younger generation with the older, I think part of it is that the demand for the younger generation to work 24/7 is so high that they're not able to care for other things in their life, so they're stretched all the time in many directions. I don't think it's a lack of loving their elderly. I think it's a lack of being able to even function their own lives, let alone take care of someone else. Because in this day and age, in that elderly age back then, you didn't work on the weekend. It was a very different lifestyle. So I think it's a combination of things, and also educating the younger generation in general, because in America, I grew up in South Africa, it's also sort of a cultural thing. There's not a very good culture around caring for your elderly here. So I think it's partly a cultural thing to blame as well. But regardless of where it's coming from, when an elderly person comes in, whether they're being in a care facility or they're being cared for with their family members at home, coming and seeing a professional massage therapist, a professional acupuncturist, a professional physical therapist is so beneficial for that person, because they're really going to care for them professionally and know exactly what to do, just like a care provider would know what to do at their home. Like the complications of caring for somebody with dementia can have a lot of variety. And so having somebody massage somebody with dementia, there's certain things you need to understand about it to know that they always forget, right? They forget that they asked you about pressure. They're going to ask you multiple times, to be patient with that and just work with that. So that's why it is important, I think, for a provider to understand, what they're working with when they see somebody elderly, so they can assist them and have compassion for them forgetting every 2 minutes, not being irritated by it, because it's just the nature of that.
Now, as you've talked a little bit about the different things such as arthritis, and touch and so forth, let's talk about as I mentioned earlier in the program, you have memory and dementia. Now, is this a somewhat common situation here?
Well, I think we are all more challenged with memory because the devices, everything's instant. We don't need to learn to remember telephone numbers anymore and all that kind of stuff. Memory overall, in general, my experience of it as a practitioner is that anybody, whether they're elderly or younger, if they're going under trauma or stress, they have a really hard time with memory. And so because you're in fight and flight. So the last thing you need to do is remember when you're in fight and flight. You need to run from a lion. And so I see memory, just massage, acupuncture, or physical therapy helping a lot with memory or dementia at any age, simply because, again, getting in tune with your body, getting back into being relaxed and calm, getting in the moment. Oh, I'm here. I'm in the moment. Oh, right, I have a body. I have a head on my shoulders. Just being able to help people recognize, or my head is on my shoulders and my shoulders on my hips. My hips are above my knees are above my ankles, and then I go from my feet all the way to the top of my head and down again. It's actually a meditation. Sometimes somebody's too busy in their mind. They're too far in the future. They're way too far in the past. They can't be in the moment. So massage, the dry skin brushing that we can do on ourselves, the essential oils, it allows us to stop, be in the moment, and calm down the central nervous system, which really helps memory. I've done quite a bit of research on dementia, and dementia is exacerbated by traumatic situations. So if somebody's elderly, they're not being taken care of properly, and they go through a trauma, the dementia escalates, the memory lapse escalates. If a client is in a situation where they have dementia, they're having, and I've actually had hands-on experience with this. I'm not a scientist, but my proof is based on what I see with the clients. The clients getting acupuncture, they have a healthy home lifestyle, they're getting massage, they're getting regular hands-on, I call it body work. I've seen that those clients, the families have reported they're calmer, they have less dementia outbreaks, they have less pain if they have arthritis. Some clients have told me they actually don't even complain about their arthritis pain anymore because they're coming in regularly enough that it's being managed, which is palliative, right? We talked about palliative in the beginning of our conversation. And I think palliative is not talked about enough. We kind of talked about things that can be cured. If something can't be cured, but it can be mitigated and you can have a palliative care treatment, it's just as good, in my mind, because our expectations can be, as a practitioner, we keep our expectations high, but we also allow it to be whatever happens. And I found that when people combine certain things together, they get incredible results. When we combine dry skin brushing is the skin tissue, right? So we're brushing the skin. The skin is the beginning of the lymphatic system, which is the white blood cells, which is our immunity, right? The other thing on the skin is the nervous system, the central nervous system, which relates to stress. And the nervous system is everything that communicates information to the brain. So that's why the dry skin brushing stimulates and moves things. That's why it's the first thing to do. The essential oils, depending on what you're wanting to achieve, peppermint's elevating, opening, lemongrass is hot, peppermint's cold. The combination of the two is like a essential oil hydrotherapy for the body. Hot and cold cause circulation. Circulation creates blood. The blood creates oxygen and healing, right? So just those two things. If you just start with those two things, no matter how old you are, what you do, and that's why clients say, well, what age do you take care of with this? I said any and every age, postpartum, in the belly, all the way up to death and dying, you can use this. It's a rejuvenation technique. And then on top of that, the touch, whether you are touching yourself by massaging the oils on yourself or you have somebody else touching you, you're building a relationship, a healthy relationship with touch, which is healing. So those are the few things that you can do at home. We do here at the center that I found those things, that little tiny things are so helpful. And then once you get that part down, then you can add in other things like the warm bath. Now, if you can't take a bath because I know you don't like a bath, your body is not in a position to physically be able to get in a bath. You can do a hot foot soak, and your feet can absorb, say we talked about this in the last show, the minerals like Himalayan salt, Epsom salt, etc., putting the salts inside water and soaking your feet. You can then absorb all of that. It will go through your body. So you can actually take a foot bath and get just as much of a benefit as a bath going through your body. So there's always a way you can modify something to make it work for you. Because usually when we get to self-care, there's all the reasons why we can't do it. Well, I can't get in a bath. Okay, well, then you can do this. Well, I can't do this. Okay, then there's another way that you can do it. I can't take off all my clothes to do skin brushing. Well, you can skin brush your abdomen and your arms and under your armpits. That's the main area of lymphatic. If you at least just cover that, you'll be doing a good job, because maybe I can't reach my feet now. But those specific things, dry skin brushing, you can find it online. You can find brushes online. A lot of people have them somewhere in their house. They got it somewhere in a bath kit, and they don't know what to do with it. Now, when you do dry skin brushing, there are different things. So there are dry skin brushes that are very dense, made out of cactus material. Those are really good for exfoliating. Then there's brushes made out of boar bristle brushes. And then there's multiple other ones, but essentially they are either very light or they're very strong. I usually recommend starting with the very light one because that's sensory. And then you're introducing the brush, waking up the tissue. Then you can use the more firm, really aggressive brush for things like the ankles, the knees. Once you dry skin brush a lot, you start to use a lot more firmer brushes because your skin's used to it. And then you really get to deep cleaning your skin, and you see a lot of results with that. So like elderly people have a lot of somebody who has diabetes, dry skin, loose skin, just dull skin. If they start to do the skin brushing technique with the essential oils, it is amazing how it helps. And one of my biggest focuses is to teach this technique to nurses, because I really believe if they did this in the hospitals, they wouldn't get bed sores like they do. If they just did skin brushing, some essential oils, and then turn the client would, it's common sense to me that it would, because a lot of bed sores is because the blood flow is not there, so it's stagnant, and then you get infection because you don't have blood to clean the oxygen to move the lymph, which is immunity, right? And so I really think that would be really helpful. Now, nurses are starting to actually learn to do acupuncture, and the massage is not quite there. That's part of my mission, is to make massage medical. We're working with Legacy Salmon Creek. We're doing health fairs at hospitals right now to expose, because it's all about being physically in there to expose yourself and show people how beneficial this is for an elderly person or anyone going through, being in a bed for a long time or anything like that. But elderly sit a lot. They sit a lot at home. So this is really good for elderly who are sitting a lot at home, for their caregivers to learn to do this kind of technique, not just massage therapists. This is, I know we mentioned here, this is really the way of prevention. Prevention is everything. Sometimes you're doing prevention, and sometimes you're doing palliative, sometimes you're doing treatment. So it kind of depends what your client is needing. The foundation of what we do, it doesn't matter what a client has. You can always modify it. So the beauty of it is there's really no contraindications. And if somebody had like a sore on their skin, they would, work around that. There are some things, but very minimal. So that's what I wanted to spend some time talking about, the dry skin brushing, because whoever is listening right now, you can do that at home, even though we do it in our facility. I think, you're on the table for an hour, but it's really important to do these things at home. With the physical therapy stuff, the prevention for anyone, and I'll specifically mention for like memory or dementia, what we're talking about. Again, it's, using a foam roller at home and doing a foam roller on your back, or using a massage tool, relaxing the muscles, getting the body to relax. That all helps with the signs of dementia. That all helps with memory. We know now that I think there's like scientific evidence now to prove that meditation helps with dementia. Yoga helps with dementia. And if you look at all of these things, massage helps with acupuncture. If you look at the common denominator of all of these things, we're calming down the body, we're getting in the moment, we're breathing, and we're reducing stress. And I think we kind of talked about this possibly last time. Reducing stress in the body, the mind, and the spirit allows the body to heal regardless of what we have going on. So I don't know if that's helpful, but you have to give me your
Absolutely.
feedback.
You know, what you think about, too, is what I think a lot of people don't realize is how detached they are from the world most of the time. The feeling of I'm here and the rest of everything else is out there. And that subtle, I believe, mental disconnect. And I know we all feel this. Maybe not all the time, but we feel it. You know, there's this person, here's me. There's this situation, there's me. Everything seems to be outside of ourselves when, in fact, the whole world is really a reflection, including your experiences, of what's going on inside. You know, when you start really connecting with that and saying, well, I'm no longer separate, then you don't feel that subtle feeling of believing you're alone. And a lot of these I can see, such as massage and touch. You're talking about essential oils, the skin brushing, things like that, help you feel alive because now you're reconnecting, you're grounding yourself back into just being alive. Does that make sense?
Oh, 100%. Personally, I need this in my life. I believe in this so much because, I've been through so much in my own life that regardless of where I am in my life, I found, if I just took a couple minutes, and sometimes it's, sometimes I have like a bunch of time to cut out, and sometimes all I get is to brush my forearms and put some oils on, and that's it for the day. That's all I get. That's all I have time for. Or maybe I forget for 2 weeks, and then my body is just craving. My clients have told me experience this too, craving the skin brushes, craving the oils, craving that time where at home I just spend some time by myself, quiet, just cleaning my skin and thinking about life and or thinking about nothing. Just, bringing you into the moment. Because when you're putting oils or brushes, you're working on yourself. In a way, you are getting connected with self-love. And I think that's the disconnect, is there's a lot of people in pain and blame, which equals, blocking, right? And we can't connect with people if we can't connect with love. They say when you die, and I've experienced this with my mom when she passed, there is an imminent love where nothing's disconnected. It's all connected. And there are multiple documentaries now where people have near-life death experiences, and they've experienced that love. And it's all the same thing where you feel everything connected. So I think the disconnect is not, I think it's really about getting in touch with ourselves, learning to love, forgiveness. You can't love until you forget and forgive, right? I feel very grateful that I've had the experience to do a lot of meditation, but then also outside of just a lot of meditation and physical yoga and even dry skin brush and all these other things is, I have found that people have a foundation in their life of prayer and faith, regardless of what your faith is. But prayer and faith, meaning truly having faith, prayer without expectation, knowing that everything is okay, regardless of what it is. This moment is perfect, right? Until I get that car or that situation or that certain person, everything is perfect as it is. Even when it's chaos, it's okay, right? I found that those people, even especially elderly, do really well in life. Even if they have a lot of pain and all that kind of stuff, it doesn't take over them. Because they just have a connection with their body. I don't know, maybe, prayer allows us to have a relationship with Source. So I think that's important to understand prayer, because not everyone can have access to all these wonderful healing modalities. Yes, they're wonderful, but if you can't get in for a massage, if you can't get in for all these things, I found that some people have everything, and they have everything dialed into the assistance, but they don't have the faith and the prayer down. They have a lot of issues that they feel they're never happy, because ultimately we all just want to be happy. So I kind of I talked a little bit about that last time, but I see that a lot, that prayer is really useful and really helpful. Everything I've ever done in my career and in my practice, it has totally come to me intuitively by instinct and common sense. and then I found that it worked. So it's really nice to base your experience off of, real experience. So when you do all these clients that do dry skin brushing or essential oils or this rejuvenation technique with the mineral foot soaks, and the one thing I didn't mention was the castor oil, which is a very important oil. Maybe we'll talk more about it next time because I don't want to take up too much of your time. But the castor oil, everyone knows about castor oil. It's a really good lymphagogue. Generally, people know about putting it on their abdomen, but castor oil cleanses the lymphatic system. So you should use, after you skin brush and you do your essential oils, or maybe you don't do your essential oils and you just do castor oil, your body, after you skin brush, your pores will be open and the oil will just suck right into your skin like a dry sponge. And you see, you can just feel the tone in your skin. You actually feel healthier physically just by putting the castor oil on after doing the dry skin brushing. Some people do castor oil, but they don't know about dry skin brushing. So then they don't get that benefit of it really absorbing deep into the skin tissue. It does make a big difference if you do the dry skin brushing and then the castor oil. If you do dry skin brushing, a hot bath, and then castor oil, then you get even more of a benefit because you totally dry out the skin. So by the time you put castor oil on, your body is like a thirsty sponge in the desert, and it just sinks all the way down into your body. And I have noticed that is one of the best ways to put castor oil on versus putting the oil in the bath or putting the oil on first and then going in the bath. So, if you want to, it depends what you want to achieve. But I found for health reasons, dry skin brush, do your oil, your castor oil, your lemon, your essential oils, then do the bathing, like your hot, warm bath, where it's a foot bath, and then your castor oil. If you don't have time for a bath, you just do castor oil after your dry brushing. So when you do, it's, dry skin brushing, oil bathing, that, I believe, goes back to ancient Egyptian times. And like in Greece and all those places, the bathing stations where you and even like in China, it's very Asian to have bathing places where you go and bathe for hours and hours. So it's something that actually has been done culturally and traditionally for centuries. Where I think in the States is where we're actually really getting used to this idea of ritualistic, which is in parentheses. I say that because it's something that should be done regularly. It's something that should be holy, sanctuary, and meaningful, not just throwing oils on you. There should be meaning behind it. It's really healing for the mind, body, and spirit. It's a good way to take care of ourselves. Cleaning the skin. Essentially, cleaning the skin. The skin is exposed to pollution, sun. I mean, our skin, if you think about it, by the end of the day, is really quite beaten up.
Absolutely. Mm-hmm.
So the clothes we wear, we can't.
Well, and you think about, for instance, women and all the makeup they put on their face. It's like, oh my goodness.
Yeah,
it's all over the place.
And anything we put on our skin, even if it's we need to clean our skin. If you never so think of it this way. So our skin is like our hair, dead skin cells. If we shed hair, we shed dead skin. We should brush our skin like we brush our hair. Once you start brushing your skin, you'll feel like brushing the skin like you brush your hair. Your nails grow and we cut them. So the skin, I'm really all about the skin thing. The skin's a big deal. So if all you take away today from this sort of conversation is dry skin brushing, take care of your skin. It's the biggest organ of your body. Essential oils, I use certain brands that are, I just say medical grade. I won't mention brands. If you want to know more about it, you can contact me because I like to stay neutral. But essentially a good essential oil that is well known, that's medically focused, is what you want to use. You don't want to use just any over-the-counter essential oil. It's not going to work as beneficial as a medical grade oil. So a quality of essential oils, you want to use, organic, self-sustainable, all that kind of stuff when you use it. The dry skin brushes, I find TJ Maxx and Ross have very cheap, brushes, but they're just as good as, anything else. On Amazon, you can find a lot of really good, or even just Google whatever, but specifically the brands I like, Hydrea, There's a handful of brands. Hydrea has a very good quality brush, and they have multiple different densities from light to firm. But every time I go buy a brush...
We could also put it to you this way, Gapina, for the listeners out there, what they could do is they can go to your website and they can contact you directly, and then you could be able to help guide them at least through that process. And then if they want to take that next bigger step, fly all the way out from wherever it could be, China, and come out there and see Gapina in the Northwest.
Actually. I'll tell you, I have traveled and lived internationally, practiced internationally, and I reside in Washington. But I know that cohesive therapy is nowhere else. What we do here is international. It's the world in a center. It really is. We do Eastern, Western modalities. Physical therapy, massage, and acupuncture is truly mind-body focused. Every treatment has hands-on, dry skin brushing, essential oils, manual therapy, meaning there is massage, there is hands-on contact with the client. And then if you're doing acupuncture, we focus on acupuncture, which we have non-needling techniques. We specialize in tuning forks. We use the vibration to stimulate the points in case needles are too much. Or we use that in addition with the needles to amplify the benefit of the needles. The physical therapy we do is a combination of the Western standard stretching as well as the yoga, Tai Chi, all that mind, body, spirit movement, foam rolling, self-massage tools. Like, how do I actually use these, for my body? And then the massage, we use the lymphatic drainage, the massage cupping with the suction cups. We didn't really get into that, but the massage cupping is something I teach my clients to do at home. And that's kind of the final piece of the rejuvenation technique where you put the cups on your stomach. You can use silicone cups. And you just park them on your stomach after you do your dry skin and your essential oil. Then I literally pour castor oil over my stomach. And then you place them on your lower abdomen. And you can literally feel all of the junk coming out of your body. And, especially my female clients, they say, is it fat or fluid? And most of my clients who throw those cups on their belly can see their waist and their bones by the time they're done, because most of us are just full of fluid. We're full of so much fluid because we're not moving enough. We're not doing enough circulatory things, because you have to pump the fluid out of the body. It does not do it by itself. You have to move. It's like the old saying, it's true, move it or lose it.
Absolutely.
So the most important thing for elderly people to do, and for everyone, is to move and sweat. We have to move. We have to sweat, or the lymph will get congested. It won't move. The lymph is the immunity, and then we start to get diseases. So it's like health is really as easy as eat well, move, eat good, move a little bit, have a balance in life. You don't have to move all the time, but you do specifically. Working is not exercise. Some people say, "Well, I run up and down the stairs everywhere."
And especially one of the suggestions that I heard.
Exercise.
Yeah, I know one suggestion that I heard about moving, and this could apply to everyone, is spend about 30 minutes of your day just walking around your neighborhood.
Yeah, absolutely.
If you can do that, and that's walk. Most people, when they think of exercise, they think especially the way we do it in America, where, it's no pain, no gain, strenuous. And I was just thinking about that earlier as we've got about a minute left. But that I've been in gyms where I would work out, and all of a sudden something hit me, and I thought, and I began enjoying it more, the weightlifting and all that, when I realized I just wanted to get into how it felt in my body, the movement of it, things like that. You watch these people strain and they grunt and they do all the things they do as though it really hurts, it's painful, but it's got to be done. And I thought how much better I felt just simply picking up even a lighter weight and just feeling my body move, just feeling it, experiencing that. And it was pretty amazing. I started looking forward to going to the gym or going for the walks, not doing the real strenuous stuff, but doing the same things that people strain with. But you're just doing them for the sheer thrill of how it feels, just to be alive and be in your body. Go, what a great thing this feels like.
100%. Yeah, and I teach yoga, and I'm actually building a modality called cohesive yoga, because I'm traditionally by heart Ashtanga yogi. And the reason I love Ashtanga is because it truly incorporates all yoga. It incorporates pranayama, breathing, asana is movement, and then the mind, body, and the spirit. The breathing is so important in yoga. You can actually heal yourself just by doing breathing exercises, but It's hard to do breathing exercises when you start because your lungs are very small, and we have a lot of stale air in our body. So there are very simple techniques that I've started to pull from the Ashtanga practice that get rid of all the stale air in your body that you can do even when you're sitting down, although it's better to be standing and moving. Something I've learned as a practitioner is you have to meet clients where they are at, not where you want them to be, where they are. And I think that is probably something I'm really working with practitioners on is you might think that client needs to change their diet and you might think that they need to move a certain way, but maybe they're not ready for that. And if you just start where they are, they will get inspired to do that because they will feel how they should be feeling. And that's kind of been my philosophy forever because for me, when I got my first massage, I was not in the best of health. And it was like a light bulb. It was like, that hurts so much, I really got to work on myself. And no one told me that. It did something for me. And so I see that body work really puts a light bulb on for people. When you do cupping on them, when you do this work on them, they get up from the table and they're like, oh, you mean that's how I'm supposed to feel? And so now they have a new gauge. They have a marker. If people don't have a marker of how they're meant to feel, a lot of people have never been exposed to this kind of stuff.
Right.
They get a light bulb. It's just organic. It's like this organic switch that goes on. And I've worked with clients, some for 8 years. And for some people, it takes 2-3 years. For some people, it's right away. But I have found that when clients get exposed, they start to eat differently. They start to exercise, and they start to do it by themselves, and then it becomes sustainable. And my clients always ask me, what should I do for exercise? I say, whatever you love that you're going to want to do because you want to do it, not because you have to exercise. That's what you need to do.
Exactly.
And so
and one thing we wanted to do,
yoga.
We've got 30 seconds left, okay?
Yeah.
Go ahead and give out a website for the listeners out there so they can find out more about your work and how they can contact you, things like that.
Okay, so my website is www.cohesivetherapy.org, and that's COHESIVETHERAPY, cohesivetherapy.org. On my site, go to the self-care page that has everything I talked about. You can absolutely email me and contact me through there. Or you can contact our office at 360-904-4999. And I offer, here at our center, we offer acupuncture, massage, physical therapy, and reflexology with a focus on organic, sustainable detoxification, relaxation, and healing.
Yeah, they'll find all that on the website, correct?
Yep, they'll find it all
good.
on the website.
Well, Gopina, thank you so much for being on the program today. And again, people can find out more about all this at it was cohesivetherapy.org, correct?
Correct.
All right, very good. Well, Gopina, thank you for being on the Beyond 50 radio program again.
Yeah, thank you for having me. Have a wonderful day.
You too. We want to thank you, the listeners out there, for joining us. You can also discover more at beyond50radio.com. That is the number 50. We do encourage you, sign up for our weekly e-newsletter and keep up to date with what's going on in the world of Beyond 50 as well as our upcoming shows. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 radio program. And remember, live your day past halfway.